Hi, my name's Alison. I'm an academic foundation trainee in my F2 year. I trained in Liverpool University and I integrated in an MRes in Women's Health. I first heard about the academic foundation programme in my 5th year. I chose to apply because I enjoyed my intercalation, which involved research into the endometrium, and I wanted to continue being involved in this research. And also I liked the research environment because you learn lots of new techniques. You can develop writing skills, you get the opportunity to submit your work for publication, so it's good for your CV, and also the opportunity to be creative, which is not something that you often get in clinical medicine. For my project, I'm at the Women's Hospital and I'm doing lab-based research into the endometrium. The project's based around the idea that we think there's different types of cells in the inner lining of the endometrium, and this might help us find out more about conditions such as endometriosis and endometrial cancer. So I'm performing lab techniques, immunohistochemistry and PCR to try and demonstrate this. I'm planning to apply to Obs and Gynae, and eventually I'd like to do a PhD, which would be 3 years full-time research, but there's lots of different paths through a career in academic research. You could do an academic clinical fellowship, which is part research and part clinical training, or you could do the AFP and then not do any more research ever again, so it's very flexible and depends on what you want to do.
Hello, my name is Helen Groves and I've been asked to record a short video just outlining why I am doing academic medicine and some pointers for those of you who are applying to the academic foundation programme. So first of all, a little bit about who I am. I am currently doing a PhD as a Wellcome Trust Research Fellow, and I'm in my 3rd year. I am a paediatric specialist trainee and have taken time out between ST4 and ST5 to do my PhD, and I previously have completed an academic clinical fellowship, and I wanted to briefly speak about why I have gotten involved in academic medicine. So first of all, why am I doing research? And certainly before I embarked on a PhD, I did speak to a lot of people about why you might want to do research, and there are a lot of different reasons you might consider it. Some people will think about it for a career, and certainly it does give you the opportunity to build your CV in many different ways. Other people will choose research for a different set of options because perhaps they're not quite sure what direction they want to go in, or alternatively just to do something different. Equally, some people will consider research for the option to have a better work-life balance, although I would caution that somewhat and tell you that I've been in all weekend in the lab doing research, so that's very dependent on your project choice. But why have I chosen to do academic medicine? And there are quite a number of reasons why. First of all, I like a challenge, and doing research definitely gives you the opportunity to do new things and to challenge yourself. I am a little bit of a geek and I wanted to learn how to do the scientific method, so I specifically have chosen to do lab-based research where I'm learning how to plan and perform and do experiments. I wanted to have an opportunity to learn a topic that I was passionate about in more detail, and certainly doing research offers that opportunity. In addition, from speaking to other people who've done research, one of the things they said they gained was resilience, and it may seem odd to say that I wanted to gain resilience through doing research, but certainly I think that's a quality that's very important in all areas of medicine and something that I wanted to develop because things do not always go according to plan. There are many times that things will go wrong. You'll have to problem solve and think of a different strategy. That's really part and parcel of research, especially a PhD, which I'm doing, and I think that that's a fantastic experience, and those skills are very valuable no matter what area of medicine you go into. But what is the main reason that I've chosen to do research? And it will sound a little cliched, but I got into medicine because I want to help patients, I want to help people. And for example, when I am standing in paediatric intensive care, doing a shift as part of my paediatrics training, we will have children with respiratory syncytial virus who've been admitted with severe bronchiolitis. Right now we don't have a treatment for that, we don't have a vaccine, we don't really have anything we can do other than ventilation and supportive therapy. And the point is, without research, that situation is not going to change. If we don't do research, then things are just going to stay the way they are in medicine. And that is the great benefit of research. I think that one of my supervisors summed it up very eloquently recently when he said, as a doctor, you can benefit the patient that you see in front of you, but as a researcher, you have the potential to benefit hundreds or indeed thousands of patients that you may never actually meet. And that may sound rather grand, but certainly it's one of the main reasons that I have chosen to get involved with research. Why would you do an academic foundation programme? It gives you a number of brilliant opportunities. One, it gives you a short space of time to try some research, to try some academic medicine, to see if it fits for you, to see if it works. It can help build connections. It can help you design a proposal that you can even take forward into a PhD or into an academic clinical fellowship programme. And it certainly gives you a flavour for what's to come. Having said that, if you're not doing an academic foundation programme place, you can still have many, many opportunities. And I think that the best thing you can do is tell people you're interested, and they will point you to the right opportunities. So the next question I wanted to talk about is, how did I get to where I am currently at? I think one of the key things that I would advise is showing an interest. Certainly that's what I did. I spoke to senior academics, I spoke to the professor of paediatrics in the area that I was working, and indicated I would like to do academic medicine, I would like to be involved in research, and that really got the ball rolling. I think if you're watching this video, you're already showing an interest, and I think that that's extremely important. Don't be afraid to ask questions, and don't be afraid to take opportunities as they come along. In my case, the opportunity came along to apply for an academic clinical fellowship, and that in itself was a very, very good learning experience, to learn how to draft proposals, to learn how to perform academic based interviews, and from that I gained a lot of experience which I was able to take forward into applying for PhD funding. So after I did my academic clinical fellowship, I applied for a PhD, and I wanted to give you a little bit of an overview of what I learned from that, because it was a very steep learning curve. I had to apply for funding for my PhD, and I had to apply for ethics approval. Both of those I had no experience of, and certainly I learned a lot in that process, and you wouldn't at this stage be expected to know everything about that, but it's good to know that that's the type of learning experiences that you will get as part of an academic foundation programme, or if you proceed to an ACF. Some of the things that I learned when applying for any type of academic post is there are really three things that they will look at. They look at person, place and proposal. And what that means is they're looking at you yourself as the person. They want to see someone who's interested and who has built up their CV where they can be. So there are many things that you can do for that. If you are currently involved in writing up a paper or doing a poster, get that done as soon as possible so that you can have that on your CV. Even if you're not, if you're involved in some other small piece of research, try and get it completed. Or if you haven't even started, as I've said before, show an interest, talk to your consultants, your senior professors, and you may find they have a project that you can jump on board with, and they'll always be very keen to have extra help. And all of this adds up to help build up your CV, and also to give you an indication of, well, what are you interested in? What are you good at? What are you passionate about? So I think showing passion and enthusiasm is extremely important, because it can be tough to get places in research, and it can be tough to get funding. I myself, the first time I applied to the Wellcome Trust, was not successful, and was fortunate to be successful the second time. And certainly I learned a lot from that. And one of the things I learned the most is don't give up, keep trying, because it can be tricky in research, but there are a lot of rewards if you keep going.
So if you're a medical student at the moment and you're considering applying to the AFP, there are things you can do that make you a stronger applicant. So no matter what year you're in, you can do a research project. I think they're called RS1 and 2 in Liverpool now, but they used to be called SSMs when I did them. So you could do a project like that and put some effort in and see if you can get the results presented in a conference or as an oral presentation or a poster. You could, when it comes to doing your medical elective, you could try and do some research during your elective. So, for example, I did my elective in Sri Lanka and I did a very basic, straightforward review of the practice of episiotomies. It didn't take very long. It was basically a literature review, but it's something that demonstrates your commitment to the specialty that you're interested in and research. And you can also do an audit. So depending on what placement you're on, you could speak to one of the doctors on the wards or the GP practice you're in and get involved in audits that are already ongoing, because there will be some in every department. And then that's something else that you can put on your CV and show that you're committed to research. My advice for anybody considering applying to the Academic Foundation Programme is to go for it, even if you're not 100% sure if you want to do it, because you'll, as part of the process, develop a CV, which is always good to have. And also if you get an interview, then that's interview practice that you won't normally get at this level. The next chance would be if you're applying for a training post, so it's good practice even if you're not sure if you want to do the project, and you can always turn it down if you do get an offer and don't want it. If you're applying for the AFP and you have a specific area of interest in mind, my advice would be to contact someone who's active in that area. It could be a consultant or a scientist, and ask them if you can have a meeting with them, see what research is going on at the moment, and if you'd be able to participate in that with them if you get onto the AFP. Or if you already have a specific project in mind, then again, contact somebody in that area and see if they'd be willing to help you with it, because you would need a supervisor.
So the final thing I wanted to talk about was just some lessons that I would like to impart of my journey so far. And certainly I'm only a little way along the academic pathway, but I've enjoyed my journey so far. Number one, I think I've probably alluded to this a little, is be tenacious. Don't give up when things don't go your way. For me, that is one of the greatest learning experiences within my research journey so far, is that it doesn't always go according to plan. It doesn't always go your way. But if you keep working hard and stick with it, the rewards are there. As I've mentioned before, I'll say again, do talk to people. Talk to people at the same level as yourself who have maybe applied the year before, and talk to people who are very senior academics. Ask them what the real story is, because you want to know what you're getting yourself in for, but equally you want to know what type of projects are out there and what opportunities there are. And you may have an idea of what you want to do, but it may not be possible at the institution you're applying for, and it's good to know that in advance. Or it may be that there's a similar project that can be you can get on board with that's already running, and often that can be much more useful. The thing that I would advise for both writing applications and for interviews is get feedback. Don't be afraid to ask senior academics or colleagues to read over your answers or to practice interviews with you. Certainly for me, the second time that I applied to the Wellcome Trust, I did a lot of practice, and that made a massive difference. Getting feedback from people who've been there before, who know what they're talking about, was invaluable. And you need to do that more than once. Do not leave it to the night before to do practice for your interview. That is not a good idea. Do some practice in the weeks running up to it, learn from it, and try again. And it makes a really huge difference to you on the day. It also stops you feeling a little bit overwhelmed when these questions come to you. In regards to advice for building up your CV, as I've mentioned before, if you're involved in a project and you've been putting it on the back burner and haven't yet finished it, try and get that finished. And even if you're not, don't be afraid to talk about what you are doing. And the final thing I would just say is be passionate. This is a difficult lifestyle at times, but I think one that's very, very rewarding, and certainly I'm loving doing research, and I think that you need to show that you are passionate about doing it and just go for it. Thank you for listening.